Yields back, and I recognize Representative Trahan from Massachusetts for her 5 minutes of questions.
I want to thank the chair and certainly the witnesses here today. In normal times, a hearing on artificial intelligence can be used to advance healthcare access would be a welcome and an important conversation. And in those times, I'd be asking how we can harness AI for powerful uses like improving medical imaging to detect diseases earlier and more accurately. But these aren't normal times. Just weeks ago, this Congress passed the largest healthcare cut in our country's history, and our federal public health agencies are in chaos with mass resignations, dismantled programs, and an exodus of scientists that leave us less prepared for outbreaks, less secure as a country, and an erosion of public trust in government and medical guidance. And as all of this unfolds, the Secretary of Health and Human Services is busy posting videos of himself drinking raw milk and competing in push-up contests. Against this backdrop, my questions today will be about AI in the clinical setting, but just pointing out some patients won't even make it there because they're going to lose their coverage. If we want technology to improve health, we must start by ensuring that people are covered. And history shows technology can either wrongfully take that coverage away or help keep people eligible and enrolled. By February 1st, 2024, more than 16 million Americans had lost Medicaid coverage as states sunset the continuous enrollment protections that were in place during COVID-19. Nearly 70% of these losses were procedural, not due to changes in eligibility, but to missed paperwork or state software glitches. These cases are a stark reminder that technology can either amplify or improve systemic problems. And it's up to policymakers to direct responsible uses of technology, design appropriate safeguards, and conduct oversight when necessary. Now, with states required to implement burdensome Medicaid paperwork requirements, thanks to the Republican Big Ugly Bill, it is critical that technology is used to protect access to care for as many folks as possible. We know that these new requirements have led to the removal of tens of thousands of Americans who are eligible for coverage in the past, and that's when these requirements were implemented for only a short time and for a small number of people. But Republicans just took that model of burdening people with unnecessary paperwork to keep their health coverage, and they expanded it nationwide. States must use every tool to keep eligible people covered and ensure that automation safeguards coverage rather than triggers wrongful terminations. In Tennessee and other states, automated eligibility systems have wrongfully cut Medicaid for thousands who were still eligible. TennCare Connect, which cost over $400 million, was meant to use income and health data to determine eligibility, but instead often misloaded data, assigned people to wrong households, and made incorrect determinations according to a federal court ruling. Dr. Mello, as we consider AI's role in health programs, what safeguards should be in place so that technology doesn't duplicate the procedural disenrollments we saw during the Medicaid unwinding?
Thank you for the question. The kind of situation that you described is frankly inexcusable. That there would be failure on that large a scale really raises fundamental questions about the amount of testing that was done before that system was rolled out and who was watching. So job one, I think, is if we're going to use automation to enforce these disenrollments, that there are humans monitoring, not particularly individual disenrollments alone, but also what is happening at the population scale. But as you say, AI could be used to improve some of these problems. And so my hope is that there will be innovation in the private sector that develops apps that enable enrollees to be put on alert before they are disenrolled. I think AI has a lot of promise for making sure people don't miss filing deadlines and are aware when the paperwork that they've submitted is not going to be sufficient.
I appreciate that. And building on that, we've also seen that even when technology is working as intended, it's often placed on top of an overly complex reporting system. It can still cause harm. Automation is often sold as a silver bullet for eligibility determinations, but in practice, when it is layered on top of complicated reporting rules, it can speed up coverage losses for people who still qualify. So I appreciate the alerts. I'm wondering if you could expound on how we design systems so that they clear barriers out of the way instead of building new ones for those who need care the most?
I think where the incentives there, collaborative design is the key there. If you involve advocates who understand what the major pitfalls and errors are that keep people wrongly off of Medicaid rolls, people who are eligible under the rules that we've set up, that goes a long way to building AI that's designed to avoid replicating those problems.
I appreciate your answers. Thank you. I yield back.